Tonight I have Randy Davis, who is the Gay Men's Sexual Health Coordinator at the Gilbert Center, and he's on tonight to talk about the Positivity campaign, which is all about HIV stigma, not just in Barrie or not just in Simcoe, not just in Ontario, but across Canada. That campaign's happening in the next couple of weeks, and the National HIV testing day, which is coming up in June, but we're talking about it now because we want to promote it. You need to be tested to know what your HIV status is. So tonight, it's all about getting tested, it's all about stigma, and it's all about Pride events coming up here in Barrie this summer. Welcome to the show, and originally today's show, as you can tell by the intro, it was going to be a duo, but tonight it's a threesome with Randy Davis from the Gilbert Center. Welcome, Randy. And Andrew Shonby from Express Aid Pharmacy is with us for the entire show, both of them for the entire show, and we have lots to talk about. But to Randy, you're at the Gilbert Center.
I am.
What's new? I hear you have a lot of testing campaign coming up, positivity campaign. You have a clinic on the go. You're very busy, and you're going to be busy all summer. Tell me about it.
I am, yes. We have our George Clinic that runs once a month on the third Wednesday of every month, Gay Men's Sexual Health. We have the National HIV testing day on June 27th.
Right.
That we're working on an event around that. And we have a national HIV anti-stigma campaign called Pozitivity that is being launched in May at Winnipeg Pride, and then traveling across the country to 25 different prides this summer.
Across the country?
Across the country.
And you're intimately involved in that. By intimately, I mean...
Meaning I'll be at most of those 25 pride celebrations.
You'll be most of the 25, yes. Intimately, yes. You'll be there. Exactly. You're their spokesperson, or...?
They've asked me to travel with the campaign. I'm also the Pride coordinator for the Prevention Access campaign, so it's been my job over the last year or so to facilitate Pride organizations signing up and becoming community partners with Prevention Access and promoting and endorsing the U=U message. So that's one of the reasons why they've asked me to tag along.
Yeah, that's great. Yeah. So when you talk walk-in, is that it's not competitive to the walk-in clinics we already know?
It's been about a year now, and we have a lot of services now going in. Most recently, we have a walk-in clinic under construction. So that's going to provide full-service walk-in services, which will help to mitigate the access to healthcare in the city. We also are going to be having a partnership with Public Health, where they will be with Simcoe Muskoka District Health, where they'll be putting in sexual health testing once a month, doing it on site. So basically, it is a full-service walk-in like you would see at the other clinics in town. Like you would see it somewhere else, okay. However, it also does offer cannabis prescribing as well as an option. So sometimes some people have access challenges with cannabis when it comes to medicinal. So that will be an option when they go there as well.
But cannabis now, you don't really need a prescription, do you?
So cannabis is available recreational, but there is still a medical interest in that. Right. You have some seniors who are maybe on multiple medications, or young people as well, who want someone who's going to monitor their care while they're on something, especially if they're going to be using cannabis in replacement of something else, what that's going to look like, what taperings will look like for their other medications. As well, there certainly is the aspect of insurance and billing if you're doing it through medical and have a prescription for that.
And you have 2 locations?
There's 2 locations, but only the Grove and Johnson location at 477 Grove is going to have the clinic right away. We are looking into having one at Leacock as soon as the Grove one is off. So
in terms of medical staff, who are you going to have, like a nurse practitioner or a doctor?
There's going to be a physician on site. And there'll also be a nurse there as well.
Every day?
So the plan right now is when it's open to be open 4 days a week to start. Yeah. And then we'll go from there and see what that looks like.
And are you looking at full day or just like?
It'll be several hours during the day, and we're looking for around May 1st opening. We've had a lot of delays though, so I don't want to promise that, but that's where we're targeted at. If you go in the store now.
Delays?
Yeah.
What could go wrong?
Well, the store right now is in a bit of a mess. So if you go in, you can see that half the store is not there. So
where, because I've been in your store, is it going to be towards the front or?
It's actually, that store was made of 2 units. Oh, so it's actually the left and right side essentially. Okay. So the pharmacy side will be there, the other side will have like a temporary wall or kind of a small wall there. And that's going to be where the clinic will go in.
And how did you come up with doing a clinic? Was there an environmental scan done, or is just something you felt there was a need because of your clients?
Well, I think in Barrie there's a big access challenge. If you go to clinics in general, if you go to their websites, you can see even what their wait times are. So putting in a clinic or getting a physician onto site is something that you'd want to do. It's something usually in pharmacy practice you try to bring to the community if you can. So we've paired up with a group that's helping us with that.
And Randy, you do a monthly clinic.
Yeah,
I mean,
George.
you do the George.
Yeah.
George.
Yes. George is the name of the gay men's sexual health clinic.
George.
Servicing.
That's an interesting concept, George.
Yeah, well, it's part of the history of the Gilbert Center, right?
Oh, I see. Okay. Like, have you seen George? That kind of thing.
Yes. I mean, and yeah, we're looking at doing some rebranding around the clinic as well. It's been very successful in the. Gosh, it'll be a year in June that that the clinic's been open now, and it was initially only going to be 6 months, but we are at capacity every month. Ideally, we'd love to be able to expand it eventually and be able to
like weekly
service more folks.
Bi-monthly, or?
Yeah, or just be able to have the capacity to help out more folks, even just on that once a month.
Not bi-monthly, I mean bi-weekly.
Yeah. And I've talked a little bit with the health unit who we partner with on this about doing a traveling clinic as well, where we would still have our monthly clinic here in Barrie at 80 Bradford at the Gilbert Center, but also have a weekly or a monthly clinic rather in say Aurelia or Wasaga Beach or Collingwood or wherever there's also a need for it, and all of those places and more have a need for it. So.
Andrew, is your clinic, are you in partnership with the health unit as well?
So it's with the health unit as well. It'd be very similar to what the George Clinic is, just kind of expanding the access across the city. Certainly we're near the college, and some people where we're at don't really have good transit access, or maybe don't drive, so it certainly gives an opportunity.
Yeah.
And in general, people know what we offer in our services, and we do service the community quite well. And people know that we're specialized in sexual health, so people kind of know to come to us. So to have that additional service just kind of makes sense in our portfolio.
Right. So some of the things that are happening, because we want to talk about a whole bunch of things throughout the show about gay men, for example, and how they talk to and who they talk to about their sexual health concerns. But before we get into all of that, which could be like 5 shows, 5 months of shows.
Easily.
We're looking at June happening, National HIV testing.
June 27th.
June 27th. Now that's
National HIV Testing Day, June 27th. Actually, international. I'm quite certain that's the same date in the States as well.
So and I think Andrew might be a part of that as well.
I'm hoping to tap in on Andrew's expertise and involvement in the day as well. Absolutely.
Is HIV testing still something, do you think, both of you, this is an open question to all of us actually, is still an issue amongst individuals, gay or straight?
Absolutely. Yeah, and that's all has to do with stigma as far as I'm concerned anyway. That's what keeps people from getting tested, and it's those folks who aren't getting tested that are undiagnosed is why we're still seeing the rates of HIV increasing.
Still?
Yeah.
In Simcoe, are you finding that?
I'm not sure.
I don't have the specific stats on Simcoe, but certainly in Ontario, in Canada, we're not seeing the decreases across the board that other countries and other cities have seen. The UK, for example, is doing a phenomenal job at reducing incidences of HIV, and that's because they have greater access to treatment for folks and some very solid anti-stigma campaigns around HIV that have really been impactful.
Do you think men are becoming more comfortable with the fact that they're not as afraid of HIV as they used to be because of it's more chronic than it was, and that it's treatable? And U equals U has certainly gone a long way in eradicating some of the stigma, wouldn't you say? Oh,
absolutely, but I still think there is the vast majority of folks out there that still think of HIV as what it was back in the early days of the epidemic. I still think there's a lot of folks who still don't know what it means to be undetectable when you're on your medication, and in turn what that means in the transmission of HIV. So there's a lot of good information that is available that we are working diligently to get out to the general public.
Right.
But it's also something that, it's not something a lot of people are comfortable talking about or want to talk about. They'd rather stick their head in the sand and pretend that it's not something that's going to affect them.
Andrew, are you getting asked about HIV testing when folks come to the pharmacy, or?
Yeah, so I'm active on social media, as you know.
Right.
I'm also active in the pharmacy. It's one of the most common questions I get. So I obviously advocate for PrEP and PEP and educate people on that, but about 90% of the questions are usually, how do I know if I have if I have an infection, where can I go to get tested as well? And that's pretty common. And I think in terms of attitudes, I do find some of the younger individuals don't have the same necessarily concerns. They don't have potentially the same connection to the past of the AIDS epidemic to some degree. But with that being the case, not having that background and that maybe that consideration, they definitely need to make sure they're being tested and make sure that we're filling in that gap, even if it's not as obvious to them to do so.
So you've talked, and some of our viewers may not know, but you've talked about PEP and PrEP. So what's the difference?
So PrEP stands for pre-exposure prophylaxis.
Right.
This is a medication, prescription medication people can take to prevent acquiring HIV. It can be quite effective if you take it exactly as prescribed. There's some studies that have seen even as high as 99% effectiveness, although it depends on exactly how they're taking it. And PEP is post-exposure prophylaxis. That is a medication, prescription medication, that you'd be taking within 72 hours if you had some sort of risk of acquiring HIV. And it's really important that if you ever have that risk exposure, that you do seek out emergency medical attention, should ideally really go to the hospital. And some hospitals will even give you a day or two supply until you can access that medication, which we always have in stock.
So they wouldn't necessarily go to the pharmacist and say, oh, I think I've had the condom broke or whatever. You wouldn't give them a script for it. They'd have to go through a doctor.
They would have to get to a doctor. Ideally, hospital would be probably a good environment for that. Potentially a walk-in clinic if absolutely necessary. But time is really the essence to do that. The earlier, the better.
And I know the health unit wants to keep stats, but it would be so much easier if a guy or a girl or someone had a high-risk encounter. They could just go to the pharmacist and say, I have a toothache. What do I need for my toothache? The pharmacist might prescribe this. I've had a high-risk encounter. The condom broke. I'm not sure. Can I get PEP or can I get PrEP?
So there are some
PrEP. I understand.
There's some. It's the only challenge with that is there are some contraindications depending on different medical histories. You generally want to get their kidney level tested and other factors like that. So I mean, to access emergency PEP in the pharmacy, even like a dose or two, that's something potentially that could be looked into down the road. Yeah. But there's a lot of considerations to go into that. And also if the person has, let's say, been sexually assaulted or something else, is the pharmacy prepared to handle that?
Right.
Are we, they're gonna need counseling and referral. Do police have to become involved? It gets a lot more complex.
And PrEP anyway, Randy, PrEP you have to have every 3 months, you have to go and get blood work done.
Ideally, yes. Yeah. I mean, I have spoken to some individuals that are on PrEP and their doctors have never followed up with them. So that is an important aspect, though. Absolutely, you need to be tested to make sure you're not already HIV positive prior to going on PrEP. And then the natural protocol is to be tested at least every 3 months thereafter. But again, I do know some doctors that don't do that follow-up, unfortunately, and that's why I certainly recommend and make sure that any individual or client that I speak to that is considering going on PrEP or is already on PrEP, to make sure that they're aware that they should be getting tested regularly.
Yeah, because in the news just recently we heard 2 guys that were on PrEP that tested positive for HIV somehow. Whether they didn't follow through on the medication as prescribed, or it happens.
Yeah, and I mean, I know the latest instance, he was taking PrEP on demand as opposed to the daily dose. That may have been.
So PrEP on demand is what? What is that?
Andrew can probably speak more to that than I can.
So basically, PrEP on demand they're looking into this as a potential alternative, because right now, if you take standard PrEP, how it's been officially indicated and prescribed according to the drug manufacturer, you take PrEP every single day, essentially.
Right.
PrEP on demand is basically you're taking the medication more aligned with sexual intercourse. So typically it follows a 2-1-1, where you would take 2 tablets, 2 to 24 hours prior to the sexual experience, and then you would take a 1 tablet, another tablet for the next 24 hours.
So
period.
4 tablets.
The 4-tablet period. However, if a person is going to be continuing being sexually active during that period, they would continue, and then continue to take 2 more after their last sexual encounter. Now, studies have actually shown this. There was a study, it was called IPERGAY study. They found about 86% risk reduction in acquiring HIV through that mechanism. So it's looking promising. And there are probably some physicians in practice, or there are some agencies that might be advocating it, but it has not been an official guideline to use it in that way. But certainly the cost is a barrier for PrEP because it's not the cheapest medication, although a lot of private plans and public plans, the Ontario plan, if you're covered, does cover it fully. And certainly the adherence factor. That's one of the biggest challenges. So if somebody isn't taking their medication every single day, there's an option to possibly find another route where they maybe could take it more when it's timed with what they're going to be engaged in.
And it's not equal across the board, because in BC it's free. PrEP is free, and in Quebec you pay $85 for your first initial prescription, and then after that it's free.
Yeah.
But in Ontario, which has one of the highest rates of HIV, you would wonder why the government hasn't approached HIV. I mean, PrEP as a PrEP as a harm reduction tool instead of charging. What is it? What does a prescription of PrEP cost a month?
So PrEP roughly costs you probably around $260, $270 a month, roughly. But keep in mind that there are some programs in place. So if somebody does not have any insurance and they're under 25, they're still covered by OHIP Plus, so that's full coverage. If they have private insurance, then their private insurance will cover percentage. Usually, not all plans do, depends on how it is, and also depends on how good your plan is. And then the last option is if you have no insurance at all and you're an adult, et cetera, you could apply to Trillium. And Trillium basically considers your income and sets a deductible and kind of gives you some assistance, but still, some people have very high deductibles and don't really see the benefit.
Yeah. Although if you're sexually active, $270 a month might be worth it in terms of peace of mind. And I mean,
it's certainly cheaper than antiretroviral medication,
which is what, $2,000 a month maybe, or
$1,500 is
$1,500 a month
on average.
On average. Wow. Anyway, getting back, so and there is Dr. Colin Lee. I know he can. We don't have a PrEP clinic, I don't think.
We do.
Gerry.
Yeah.
We do.
So yeah, I opened. So right now we have some kind of a pop-up addiction clinic in both locations, where actually we have a doctor who comes on site to prescribe for that. And I had asked that physician if they'd be comfortable to prescribe PrEP. We kind of worked together on what that would look like. And now the pharmacy actually does offer drop-in, walk-in for PrEP. So we've had that for a couple months now.
Okay.
On site, it's Tuesdays and Wednesdays he's in for that.
So any referral needed, or
there's no referral needed. Just people need to understand that if you come to the clinic, you don't walk in and get PrEP that moment. You have to get initial blood work, which Randy alluded to, and then typically you'd come back in 4 weeks for your next assessment, and then you'd be given the medication.
So when you get tested immediately, is it point of care testing, or is it a blood draw?
No, because you have to do several tests when you go on PrEP, including kidney function, and of course you want to make sure you have an HIV negative test.
Right.
Because if you were positive while taking PrEP is not sufficient to treat HIV. You would need to be in a more significant combination. And if you were positive and you went on PrEP, potentially you could develop resistance to the medication that's in PrEP. And then you could also potentially develop cross-resistance to other antiretrovirals. So it gets kind of messy. It's not super common to occur, and typically if a doctor is monitoring you closely, which is standard protocol, it doesn't become a major issue.
Well, that's good to know. I mean, anyway, good to know.
Yeah.
No problem.
So, and that's at both pharmacies?
That's at both, yeah, he's there once a week at both locations. So Tuesday mornings and Wednesday.
And that would be on your website, wouldn't it?
It is on our website, yes. So if you go to expressaidpharmacy.com or expressaidpharmacy.com/allaboutprep, you can learn more about that.
It's in that, because, I mean, PrEP is actually, if you are sexually active as a gay male, it's a male, period. And what about females and PrEP?
So there have been some studies looking into whether females should use that or not. Certainly somebody who is, if the current Canadian guidelines do consider heterosexual individuals or females, or females who identify in different ways, right. That is something they certainly should consider, especially if, let's say, they're with a partner who is not undetectable and there is a risk of transmission. That would be a consideration as well.
Randy, are you seeing that with your clients? Are they asking about PrEP, or?
Certainly to some degree. I don't get as many clients, obviously, as Andrew does with respect to medications per se. The majority of my clients are talking more about various antiretrovirals and
adherence to medication. Because you see,
yeah. I mean, I spoke to a gentleman just a few weeks ago who happened to be on the same antiretroviral that I'm on, that I've been on for 3 years. He's recently switched off it to another drug, and some of the side effects that he was talking about were, it's like I was checking off the boxes when we were speaking. It's like, you know what, I've had all the same side effects for 3 years, so I've just I just actually came back from a doctor's appointment, and I'm switching to that medication that he was on, and I'm hoping that that's going to help alleviate some of the effects of the antiretroviral that I've been experiencing for 3 years now.
Yeah, because you're dealing, a lot of your clients, if I'm correct, tend to be HIV positive.
Yes.
in a lot of cases.
Yeah.
But at the George Clinic, does PrEP come up a lot, or?
Not so much in our end. I know it's talked about more when we walk the folks over to the health unit and they have their discussions
Right.
with the nurses there. What we do right at the Gilbert Center, we do point of care HCV testing, so for Hep C. Hopefully, eventually we'll get point of care HIV testing right on site as well. But certainly we definitely talk about it. Now that I know that Andrew has the PrEP clinic, I'll make sure we've got some flyers to ensure our clients are aware of that as well. But most of those conversations happen with the nursing staff at the health unit.
I've heard of home testing for HIV. Have you been asked about that, Andrew?
People do ask for that. There's no official indication in Canada for that use. I know there are some concerns with how it's being used, and also the concern, of course, if you do become positive, how do you interpret your result? Where do you go? It's not something that's great. I know people do order them online when they try to get them from the U.S. or somewhere else, but it's not something that we're really at right now in Canada.
Yeah, yeah. Anyway, getting back to, so we got off the topic of national HIV testing, but still, among testing for HIV tests are still predominantly gay guys that are accessing, or it's... Excuse me.
I would venture to say yes. I mean,
Yes.
again, I don't have the solid stats to back that up, but yeah, absolutely. That's the gay male population is still the population that is hardest hit by the epidemic. So it's certainly forefront in the minds of most guys who are gay and sexually active. So yeah, I would think that the majority of those looking for testing are from that community. But it's one of those things that it's there's a lot of straight guys that are out there that are having sex with men
And have female partners.
and have female partners, and the stigma around the idea of being tested for HIV and, you know, admitting that they may indeed be gay or bisexual or have whatever tendencies they might lean towards, keeps a lot of those guys from getting tested.
And I would think too, women who are on birth control, who aren't in the habit of using condoms, or their partners using condoms, or tend not to use condoms, might not be willing or not be that familiar with the fact that they should be using condoms. Mm-hmm. Because not getting pregnant is one thing, but HIV is just like it's lifetime. Sure. And can be devastating. And as you said earlier in the show, it's still stigmatizing, which U equals U has shown.
Yeah, and again, I speak from my own experience, so I allude to gay men, but certainly HIV, the contraction of HIV through injected drugs is certainly problematic for some folks as well, and that gay, straight, what have you. Again, a recent client that I spoke with newly contracted HIV, and that was through intravenous drug use. So.
Which we all know is a problem here in Barrie.
Yes, absolutely.
The opioid crisis has affected all of us. So national HIV testing, what kind of, it's a national campaign. How is it being, or I know it's early stages yet, but how is it going to be rolled out?
Yeah, it's very early stages, and we're literally just in the planning stages now of what we want to see. I can tell you what we're hoping it will look like. Ideally, we'd like to have a testing site set up in the rotunda at City Hall. I'd like to design a flag and have a flag raising at City Hall so that the National HIV testing flag can wave for the day. We'd love to have some local celebrities volunteer to be tested, whether that be local city councilors or some of the better known names in our business community, maybe even some local celebrities. That's sort of the way we're looking at things going now. But again, very early stages. The big part of the National HIV testing campaign is also going to be around U equals U as well, and making sure that message gets out that, get tested. The worst thing that happens, you go on medications, and within 3 to 6 months, you attain an undetectable viral load, and you're unable to transmit the virus.
I know in England they did one with Rihanna and Prince Harry.
Right.
And that was like, wow.
Yeah, absolutely. I mean,
but it caused a lot of hype, and it normalized it.
Yeah.
We can remember when Diana, his mother, Princess Diana, went, and she was actually one of the first persons to actually touch people who are HIV positive and normalized it in terms of that's not how you get HIV.
Well, I know just yesterday was the anniversary of the announcement of Rock Hudson's death. And there was an article I read about Doris Day and what a significant move it was for her in fighting the stigma against HIV back 30 years ago, when one of his last public appearances was on her show and she kissed him on the cheek. That was very impactful 30 years ago, to actually kiss someone on the cheek or anywhere else.
Did she know he was HIV positive?
Oh, I think at that point everyone knew what was going on. But
yeah.
But I think it's great that you're going to be having lots of possibly celebrities or people in Barrie all across, because we talked about this a bit before the episode, actually, that it's an issue that everybody needs to be aware of.
Yeah.
Sometimes a lot of the marketing and targeting tends to be, let's say, to MSM, so men who have sex with men community, when really, if you look at guidelines, even the CDC, they're looking at recommending from 13 to 65 to make sure they have an HIV test. And we know that one of the highest risks for older adults of acquiring HIV is through heterosexual sex. So
exactly.
It's a concern. It's not something that people are having conversations with. A 6-year-old woman goes to see their doctor. Does that come up in conversations typically? Probably not.
Well, I mean, it's known among many gerontologists, for example, that women and men in their 60s are having sex. Mm-hmm. Viagra has helped men to continue to be very virile when it comes to having sex. And I think I was telling you, Andrew, before we went on the show, that there was a study out of the University of Waterloo here in Ontario with Dr. Bullock, who did a whole series of Q&As with snowbirds that were flying down into Orange County. 15% of new HIV tests, or HIV positive tests, were amongst the 55-year-olds and up, and predominantly among women who were postmenopausal, who were either widowed or divorced, and were sexually active, and weren't in a position where they knew about condoms or even the pill, and they weren't worried about getting pregnant, right?
Yeah, exactly. So sometimes it might be maybe they're divorced or in second relationships. Right. They're not concerned about pregnancy, which is sometimes the forefront. There's also local changes due to menopause that may increase bleeding risk. Right. So all those factors, and also you mentioned Viagra. If somebody is having erectile difficulty, they may be less inclined to use condoms as well. So you use that whole combination, right, and it's concerning, especially if somebody is like a woman who's 50, 60, they're not thinking about it. Meanwhile, they've contracted HIV and it's progressing. They're possibly spreading it, and also it's getting worse in their body as well. So it's just a really nasty kind of combination occurring there.
So we'll be back. We'll be back with Andrew and Randy after the break. So we're back with Randy Davis from the Gilbert Center and Andrew Seanby from Express 8 Pharmacy. And we were talking about clinics, and we spent a lot of time talking about HIV and the national, about HIV testing and PrEP and PEP. And we also talked about both your clinics and national HIV testing. June 27th, you're thinking maybe the Rotunda. Cross your fingers.
Got a meeting on Monday where we're going to discuss some other possibilities, and we're fortunate enough to have a marketing company that's doing some pro bono work for us now, that's going to come in and hopefully give some good ideas as well. So.
And the other campaign, oh, I got a voicemail. Must be somebody calling in to see what's going on. I have a question. We're going to talk about pozitivity campaign as well.
Yes.
That is like POS capital and then lowercase.
POZ.
Oh, POZ.
POZ.
Oh, POZ.
Yeah.
Good to know.
Yeah, the pause.
Pause, not POS.
Not positivity.
Not
yes.
it's a pause.
Yeah.
Okay, pause.
Play on words.
Play on words.
Yeah, alliteration, all that fun stuff.
Right, and that's happening. Well, we said in the beginning it was going to go from May to.
Yeah, the first Pride that we're going to be at is in Winnipeg in May. I can't even remember which is the final Pride we're at, but in August, late August, we'll be. Not sure whether Montreal is going to be the final one or what, but yeah, we're.
Well, Simcoe Pride goes into August here in Barrie.
Yes, yeah. We're not sure what the date is for us here locally for the campaign yet until we have more specifics on what's
So Winnipeg
here.
is the first, and then wherever the next one is, and the next
Winnipeg.
one is. Are you going to be at all of them?
Winnipeg, then we go to Edmonton, then we're in Regina, and across.
So
the
you're out
country.
west initially.
Yes, but then we go back because Vancouver is later in July. So, but yeah, we'll be at all the major Pride events.
Are they giving you a plane, your private plane?
He's a busy guy.
Like a campaign plane.
That's funny. They haven't mentioned how it's happening yet.
Like
They've
a
just sent me
like a
a
little
preliminary itinerary.
Private jet to fly you
I
around.
don't think we have quite that much money, but
But that's a lot of flying around.
yeah, it's
I
going to be a
mean-
busy summer.
Yeah, yeah.
It's going to be a busy summer, but it's important work. And what's really important for me, anyway, with respect to this campaign, is that it's going to be very heavily focused on the U equals U message and movement. That was one of the things that the Gilbert Centre was asked to be part of this right from the get-go. It's spearheaded by the Canadian Centre for Gender and Sexual Diversity out of Ottawa. It's a $500,000 grant from the Public Health Agency of Canada to run this campaign. And when we agreed to come on board, it was with the understanding that
Right.
that U equals U is going to have to be a big part of it, and that a lot of the input into what this anti-stigma campaign was going to look like was going to be from folks like me who are living with HIV. It's not
So
going to
U
be
equals U again is undetectable, because it's written on your shirts
Yeah,
anyway.
undetectable
Because I
equals
don't have
untransmittable.
one, so I can't really. I have to look at your shirts, but undetectable
I have to
equals.
special order your size.
Oh,
Yeah, right. Undetectable equals untransmittable. So that's part. But the positivity campaign itself is what is that campaign? It's not about it's about U equals U, but it's more than that.
Yeah, it's targeting the MSM community, so men who have sex with men, which is why it's targeted towards Pride festivities. And it's simply to get the message out there to get tested. There's going to be a lot of workshops and presentations around lived experience. So
Right.
we're going to have different folks in each local area come out and talk about their experiences with respect to the stigma that they face simply because they carry HIV. You know, it's something that I've experienced for a little over 3 years now, and the amount of hate and misinformation that is out there around a highly manageable illness. I always talk about the fact that I liken HIV to diabetes. I find it's actually easier to manage than a diabetic, who I have a few in my family, so I know they're constantly checking their blood sugars and having to monitor that. I just take a pill a day and talk to my doctor once every 3 to 6 months and get my blood work tested. And
now you can do telemedicine, so you don't, because HIV specialists are predominantly in Toronto.
Yeah,
Although
exactly.
There is a clinic, or not Soldiers, but Stevenson Memorial with a Dr. Downey, but that's
that's the one HIV specialist for
that's
all
close,
of Simcoe County.
Yeah, it's closer to Simcoe County.
Yeah. So my HIV specialist is actually out of Toronto, and the vast majority of my visits with him are 15 minutes in front of my computer. Hey, how you doing? Your blood work came back great. Talk to you in 3 months.
Andrew, before we went to break, you mentioned something, and now it slipped my mind.
I think we were discussing stigma in general with HIV.
Right.
And what I kind of deal with when I'm answering questions online and when I meet people. And it comes up a lot where people don't really understand even how to properly address it. There are some people who use terms like clean. They'll say, oh, how do I know if I'm clean or not? Someone will ask me. Or you'll see people saying they're looking to meet people who are clean. And just using that word can have such a high level of stigma. You're implying that somebody who has HIV or who happens to have another infection is somehow unclean.
Or dirty.
Or dirty, and that's not the case at all. And that just perpetuates it. And I think it's not just I don't really think the people who who have that or ask those questions are bad people. I think it just comes down to education and getting that information out there.
Right.
People need to appreciate that when you let's say meet somebody for sexual intercourse, or you're dating somebody and that you don't know their status, you don't know. Someone who is on HIV medication, undetectable, you know they're being monitored regularly. You know they tend to be more inclined to be tested for STIs and things like that. So there's actually some protections in that way, and so people have to kind of flip their minds and look at this a little bit differently than how they have in the past.
Because you see that on social media, on sites like, I don't know, like Grindr, for example,
Yep.
or other sites like that, these hookup sites, where you see that in people's profiles. I hear that people say clean, you have to be clean, you have to be clean. But Positivity campaign is trying to address that kind of, because even within the gay community, you have that stigmatization amongst the gay, within the gay community, never mind in the general population, right?
Yeah, which is very disheartening. You would think in a community that has been devastated the way it has by this epidemic that there'd be more understanding, but there's also so much fear around HIV, and that's always my definition of stigma. It's a combination of fear and ignorance, and that's why education is so important, and why it's so important to have people speaking up about their own lived experiences, so that Joe Smith on the street can look at me as someone in 2019 living with HIV, and I'm probably healthier than I've ever been. And as Andrew mentioned, when I get my blood work done, I get tested for all the STIs. So yeah, I'm one of the safest people to have sex with.
Because the issue at hand is people don't...
Is this a promotion?
Yeah.
A little bit of self-promotion, maybe.
Well,
Really?
yeah. But I think the issue at hand for a lot of people who aren't aware, this is what comes up a lot, people asking you whether they have HIV or how do they know. You don't really know unless you've progressed for a while and you start getting quite sick, but you don't know. So people who go online and say, oh, I'm negative, or don't even know, or they, it's a problem. And that's where kind of the stigma kind of comes around with. So to know that somebody actually is HIV positive, then you know exactly the situation. There's so many unknowns when you're meeting somebody online, for example.
It's interesting you say that, because I often wonder, like online you hear profiles that say, I'm on PrEP. Well, how do I know you're on PrEP?
Oh.
You can say it, but doesn't mean you are, and it doesn't mean in order so they can have condomless sex, I'm on PrEP. But do you have a card that says?
Well, I guess that's for anything, right?
I mean, it can say I'm
what
undetectable.
What color is the pill? What's the name of the pill?
I think the thing to appreciate ultimately is that if you are going to meet anybody, there's risk involved. If you don't know somebody very well, you don't necessarily know have they been tested. You don't know if they're undetectable. You don't know if they're on PrEP. There's risk involved. So that's why people need to consider, are condoms appropriate? Vaccinations against Hep B, are these things, HPV, are these things that you'd want to consider? And kind of go from there. And
do you think social media has made it much more accessible to have sex? Sex is a lot easier to hook up today than it was, let's say, 30 years ago.
Sure.
There are no bathhouses that I'm aware of in Barrie, and so a lot of social media sites, hookup sites, allow you to meet up with people very quickly, geographically as well as time of day, whenever. Has that caused a concern in terms of rates of STIs, like generally going up, whether it's HIV or chlamydia, or I hear gonorrhea?
We last time I was on your show, when we launched the sexual health campaign, Just Ask, we actually addressed this, and that was part of why we had partly why we launched that campaign, because even Simcoe County had unprecedented levels of gonorrhea rates increasing, and this is across all gender identities, all sexual orientations. So some people want to point to PrEP and other things as being motivators for why this would occur, but even in people who aren't on PrEP, people who are more inclined to be in heterosexual relationships, there is an increase of STIs. And certainly when you look at things like Tinder and other access, this has to have some sort of impact, and some studies have certainly looked into that.
It's interesting you say that, Andrew, because Aurelia had the highest rate of gonorrhea from my research, and the highest rate of teen pregnancy was in Aurelia. Is it because they have several universities, or is it really the water in Couchiching Bay?
That's the whole
nothing to laugh about, but I mean, it does have one of the highest rates. I mean, Aurelia in Simcoe. So I would have. Anyway, it's interesting that STIs are still on the increase in spite of having condoms and PrEP and education. We're much more highly educated about sexually transmitted infections than we were even 30 years ago. Are you asked about that a lot, Andrew?
So, like I said, we get a lot of questions on sexual transmitted infections in general. How can you acquire one? How can you prevent one? How do you know if you have one? And I think it goes back to even HIV. Some of these infections you don't know if you have. So chlamydia can be asymptomatic, gonorrhea can be asymptomatic, and then you can transfer it on to other people.
And syphilis, right? If you can have it, is syphilis, do you get a discharge with syphilis? Or
syphilis, you get kind of what they call
a birdie?
It's like a red spot, I forget the term for it, but you can basically get a spot or like a mark where the virus has that, or where the bacteria, the bacteria has caused the infection.
And then it dissipates, and does it go away?
It does, and then you can also, basically, because syphilis actually has 4 stages, so you kind of get through the initial stage, then you get a secondary stage where you can kind of get a rash and fever and just feel really sick. Then you can get into a latent stage.
Where's the rash, like all over? Or?
It can be in different areas, yeah. And then the later stage is when you basically get one that's kind of latent, where it kind of is at bay for a bit, and then it can advance to this really bad tertiary stage, where essentially you can start getting damage to your heart and brain and things like that, and that's when it gets really bad. So that's really important to be getting tested. And for people who are wondering, okay, how do I get these things, the risk factors can include anal sex, vaginal sex, and oral sex as well. So certainly if you are engaging in those activities, you should be getting full panel STI testing typically. And also if you are going in for testing, one thing I do want to mention just casually here, that if you are going in, it's usually a good idea, especially if you are MSM, if you're having sex with men, you need to generally advise the nurse or doctor when you're going in, because they also will test sites where you might be at risk. So typically for gonorrhea and chlamydia, they might just do urine collection, but if you're MSM, they may also do a throat swab or an anal swab, rectal swab.
Right, and some of these STIs, like syphilis or gonorrhea, it dissipates or it internalizes, and most men, not most men, but a lot of men, or generally men in general, think, oh, it's gone away, so I don't have to worry about it. I guess I thought I might worry about it, but now it's gone. But generally speaking, we were talking before we went on air about men in general going to a healthcare physician and talking and not being comfortable. And I think I was asking Andrew, are folks more apt to speak to you about STIs, for example, or issues around sexual health than they would be their primary caregiver, like a doctor?
Well, I mean, I don't have that kind of relationship with them where maybe the doctor's seen them since they were a child. So for me, it's very nonchalant. It can be very casual. It can be just a quick question online or even a quick question in pharmacy. May never see them again, so they maybe feel more inclined, or maybe I just seem more inviting for that kind of conversation. But some people don't want to have the conversation with their doctors. Some will not prescribe PrEP for them. Some don't know a lot of these medications. Some don't have family doctors, which is an issue up here. And we certainly have international students as well who don't really necessarily know where to access resources. And if any international students are watching, or anyone by any chance, public health, when these clinics are available, George or at Simcoe, Muskoka District Health, or when we have it, anyone can go and there's no charge for it.
Oh.
Yeah. So that's one thing that always comes up.
So you don't need a health card?
You don't need a health card, no. And because it's a public health issue, right? So they want to make sure everybody has access to that service.
You only have to use your real name if you don't want to.
Yeah.
It's anonymous.
Yeah, can be.
But at George, you don't do blood draw. Oh, yes, you do. If you had to.
I don't, but
no,
yes.
You don't, but...
But yes, the health unit does, for sure.
And they also do Hep C testing.
Correct.
And the same thing with Andrew's clinic. Okay, so getting back to the whole subject of men in general, gay men, for example, talking to their family physician, if they don't have one, there could be family physicians or physicians that don't even want to go there, or afraid of disclosure, or a married man that's having sex with men and has a female partner might not want to talk to his doctor about having sex with men. You know,
yeah, I mean, that's a whole other issue, though.
Yeah,
I mean, that's...
No, but it's part of...
It's a big barrier.
Yeah, absolutely.
For sure.
But I think the bottom line is, if you are having sex, whether you're a gay man having sex, or whether you're heterosexual, or whether you're a woman having sex, it's all about taking responsibility for yourself first.
Yes.
And that's why testing is so important, because you don't always know if you're on a hookup site who you're hooking up with. And while I think the vast majority of anybody that puts on their profile that they're undetectable, I would say 99.9% of the time you can take that as fact that they likely are undetectable. But again, the onus has got to fall on the individual themselves to protect themselves. And sex is fun. I know I enjoy having sex. I enjoy having a lot of sex. And one of the things that's important about that is making sure that
It's getting hot in here.
no, but I'm serious. The whole idea of
Why don't you just give your phone number and be done with it?
it's just, but the whole idea of sex shaming
Yes.
is a big problem as well, and that's also what keeps folk from getting tested, because they enjoy having sex, they have a lot of sex, but they don't want to talk about it. They don't want people to know that they're having sex. What's wrong with people knowing that you have sex? So I think the more you talk about it and talk about sex and the type of sex you have, and because everybody has a different idea of what is pleasurable for them and different kinks and that kind of thing, that for some certainly put you in a higher risk for certain STIs or STBBIs than traditional traditional sex acts. So it's something that's very important to talk about and encourage folks to be open and honest about it, especially with their healthcare providers. Because if your healthcare provider doesn't know and you're not advocating for yourself, chances are they're not going to bring it up.
I know when I work with seniors, you hear this a lot, that a lot of folks just think that you move into a retirement, long-term care facility, retirement home, and you're 60, 75, and there's no privacy, and they wonder, well, why would they want to be private? Well, they might want to have sex. What? Like the thought of a 75-year-old man and woman having sex is like, oh my goodness, are you kidding me? But it's not all.
And for me, the thought of getting to that age and not having sex is, are you kidding me? Well, I hope not.
But sex isn't always about intercourse. It can be other. There's other ways of indulging in sexual intimacy.
But just like oral sex, you can get STIs through oral sex as well, right? So it's all about making sure that these conversations are conversations that you can have and not be embarrassed or feel, that they have to hide behind some sort of cloak of anonymity because they're talking about sex. The more openly and honestly we talk about it, the easier it is for folks to relax around it and talk to their physicians and talk about getting tested. It's one thing leads to another, right?
But wouldn't we agree that the more transparent you can be and the more honest you can be about your sexual health care needs, the more apt a doctor or a pharmacist is able to help you? But if you're hiding, if you're not willing to disclose everything, then it's hard to prescribe or it's hard to counsel someone if they're not saying, okay, I'm a married dude and I'm having anal sex. Yeah. Well, if they don't say that part, if they omit that part, that could be between how you respond to their questioning and how you don't respond. Would you?
I think you have to, it's a combination. The individual, the patient certainly needs to be able to feel comfortable to express themselves, but at the same time, that pharmacist or that doctor needs to kind of set the stage so that that individual feels comfortable to share that. Especially for young people too, they're not going to be the ones to initiate that conversation. And it really comes down to just, further, Randy does a great job with the organizations that he's involved with to spread that message out. But certainly, when I was in pharmacy school, we didn't really talk about MSM. We didn't talk about gender identity health, transgender health. We didn't really come up with that. So a lot of the stuff that we do in the pharmacy is a lot of my own just accessing research. There aren't like a lot of courses or programs even for me to access to learn more if I wanted to. So there's that barrier. But we do, I ultimately agree with what Randy said before as well about normalizing sexual behavior, that is to be a very casual conversation. Some people were very kind of warned me when we started doing it in the pharmacy that, hey, people are going to be really against this, that you're doing this and you're pushing sex and all this. And it's not. We're naturally sexual beings, and it's a part of our lives, and it should be just as casual as discussing anything else, diabetes or any other medical condition or any other medical concern somebody has.
It's come to the forefront anyway, a lot of holistic approach to living today, where going to the dentist now is becoming, I'm shocked that some people say, I haven't been to the dentist in 10 years. What? Or I haven't had my eyes checked in 20 years. I haven't had this done in 20 years. I haven't done that in 30 years. It's all part of customizing ourselves that sexual health is part of a healthy brain health, physical health, sexual health, eye health, dental health is all part of a healthy lifestyle, is it not?
Agreed.
Eating well?
Sure.
I think it's interesting you raise that, because now that I think about it in practice, there are some people who will wait a very long time to get a lot of their healthcare needs checked. So sexual health is just an extension of that, where they maybe don't focus on that or don't consider it. It's interesting.
Yeah, it's interesting because I have a friend that went to the dentist, and the dentist noticed a lump in their throat, and it was thyroid. They had a thyroid issue. And then Katie Couric, on whatever channel she is on the U.S., a viewer looked at her. Was it Katie Couric or
somebody? I heard about
somebody like that, and noticed that they had a lump in their. I guess thyroid is right in here somewhere. I don't know, right there, and noticed it and sent an email or a text message or something to the television station and said, I noticed, and sure enough, she had an enlarged thyroid, and it eventually did lead to, it was positive for cancer down the road, not immediately then, but noticed it. And this friend of mine it was the dentist that said, you should go and get that checked because you got a lump. And my dentist checks your throat and everything. What are you doing all that for? And they're looking for cancer or something that's telltale that you might want to get checked out. So you're right, it is something, and if you don't go, how will they know? If you never go to a doctor, how will you know?
Mm-hmm. Well, and there in turn we talk about access to care, and the reason why some folks don't go to the doctor often is they don't have access to a doctor, or there's other barriers that keep them from being able to access treatment. So, and then we've got another 4-hour show just on that alone.
Yeah, and it's interesting because I remember, because you two would not remember because you're not young enough, not old enough. Young enough, yes, not old enough. When Betty Ford came out as having issues with alcohol, she was getting through her day-to-day routine as First Lady of the U.S. by drinking, and when she came out as requiring alcohol treatment, addiction treatment for alcohol, it normalized it, and the Betty Ford Clinic is one of the main clinics in the U.S. now and Angelina Jolie raising awareness about breast cancer. And so you're right about, when you're talking about national HIV testing, getting some notoriety. That's it. Around this, it would normalize it. Like, I don't know, put it out there. Like, I don't know, maybe.
Yeah, and I mean, I'm not looking for a celebrity who happens to be HIV positive. Just a celebrity willing to, or more than one, willing to get tested and normalize the fact that it's part of good sexual health to be tested for HIV.
And you don't have to be gay, because
no,
HIV,
absolutely not. HIV doesn't care whether you're gay or not.
No, we've addressed that already earlier, right?
Yeah,
for sure. So
yeah, so that would make total sense. So getting back to, again, I'm interested about both your opinions on why are men generally in 2019 still uncomfortable talking about health, be it sexual, or be it prostate health, or having erectile difficulties, or whatever. We seem to tend to not want to talk about it, or not comfortable.
I mean, just from my perspective, I'm obviously very comfortable talking about it. But when I think about the men I know in my life, it's probably because they're men, and we're supposed to be strong, and nothing hurts us, nothing affects us. So I don't need to go to a doctor because I'm fine. That's when you look at someone and ask them how they are, especially a male, they're going to tell you I'm fine, whether they really are or not. In many cases, so that vulnerability around being ill is something that a lot of men aren't willing to accept. So I think that may be part of what keeps guys from going to the doctor. Just from my perspective.
Things like testicular cancer, I always thought I always heard it was a young man's disease, and I remember saying to my doctor, "Oh, now I'm over 50, I don't have to worry about it." No, you still have to worry about it, because testicular cancer can happen to men at any age. Breast cancer, we both know someone, a male, who had breast cancer, and I remember saying to that individual, breast cancer, I had breast cancer, and it was the first man I'd ever heard say that they had breast cancer, and they had checked and they had a lump. And it was do you talk about that with your, not breast cancer, but in the pharmacy, in the clinic, does that come up about prostate cancer, testicular cancer, breast cancer among men? Because we hear a lot about prostate.
it's not really a conversation. Pretty much I think the main ones we have in conversation are usually the ones that are heavily fundraised for, or the ones that are heavily in the media. So people certainly are more concerned about prostate cancer, breast cancer, things like that. Especially because men, as they age, the prostate does enlarge, affecting like urination and things like that. So we deal with a lot of that in the pharmacy. So certainly they ask about that. Usually if there's a major health issue that's common, then you get more questions. If it's less common or it's not as heavily discussed, it doesn't seem to have the same interest.
But for prostate cancer, isn't it like isn't it PSA? Or
they can do a PSA test.
For it. You don't have to do the
You could do a digital.
What's it called? Well. Digital exam?
A digital rectal exam.
It doesn't have to be that way. It can be.
Yeah.
Can it? But that's the only two ways, right? The PSA test or the digital, that's
Those are the primary assessment ways that they would do for early.
And testicular, well, everybody can, not everybody. Hey, come over and check for testicular cancer. What am I saying?
which
you can do it yourself. But how many men even think to do that? You know, like.
Well, again, and it's just like females testing for breast cancer. I mean, it's a self-exam that can be done while you're showering every morning. You know, it's again something that takes very little time and is easy to do. And it's all about. Correct me if I'm wrong. It's all about knowing your body, and when you sense or feel a change in your body, that should be a red flag. And the sooner you notice it, and can talk to a healthcare professional about it, the sooner the likelihood is of a better outcome.
But women seem to be able to be more comfortable. They talk about yeast infection. They get pregnant. They're in the doctors a lot for throughout a lifetime. A woman is in the doctor's office a lot more than a man for ordinary things, not necessarily, you know, like for pap smear, monograms. When they have babies, they're in and out. The doctors are checking them out all over when you get pregnant, I suppose. I don't know. Well, you've had a wife with you've had a wife with kids, and I've.
That's true. Yes.
It's true.
No, it's very.
We don't want to talk about it. But I mean, my point is that women seem to be in and out of like gynecologists or in and out of doctors a lot more frequently than men for normal activity of living, for sexual health, for, you know, they're just.
No, I mean, I get your point. I think you're right. The female population is probably more prone to see a healthcare professional on a regular basis, much more so than the male population.
Right.
You know.
Okay. I've just been. Our time is up, and I don't know. Did we get everything covered? We didn't. You'll both have to come back on.
We covered a lot.
Randy from the Gilbert Center.
Thank you, Gerry.
Andrew Seanby from Express Aid, and good success with your clinic. And
thank you.
May or may not be May 1, but around
May,
there.
June, yeah.
Okay, we'll be back next week. Thank you very much for checking in with Gerry.